checkup where we are conducting a 15-minute health assessment where one of the employee who is a 50-year-old factory worker does not want to cooperate with assessment because he thinks the employer will have access to his medical information.
All right.
And yeah.
All right. So it is a normal health checkup which has been conducted in a factory. I mean in an organization for the factory workers. It is 15 minutes health assessment for each and every factory workers. And whereas one of the workers, he is reluctant and he doesn't want to cooperate because he has some kind of issues. It would hamper his job and he might lose his job in case if he's suffering from any kind of any kind of health issues. So he is non-cooperative. So it is your responsibility in order to convince and counsel and make the patient to take this medical assessment in what way it is going to help. At the same time, the confidentiality will not be disclosed to others without the patient's consent. That concerned person, without his permission, you are not going to disclose the confidential medical illness to others, even to the boss or to the organization. That you have to speak firmly. Okay?
Okay.
All right. You could start your speech.
Good morning. I'm Dr. Sarah. I'm here for health checkups for all of you.
Okay.
Shall I go with all of you or just for you?
One particular person, right?
Yeah. Okay. Good morning. I'm Dr. Sarah. I'm here for a 15-minute health checkup. So, I got to know that you're not willing for it. May I know why?
Okay. You can check with the patient. May I know your name and age? Okay.
Okay.
All right. So I would be starting good morning, Dr. Sarah. Good to know that the organization arranged for a kind of health assessment for each and every factory workers. It is a good gesture, but I'm really afraid to go for it. Well, my name is John. I'm 40 years old. I'm afraid to go for it mainly because in case if I have some kind of health issues, I believe that could really hamper my job. I would get terminated. I might lose my job. So that's my fear, doctor.
Mr. John, I would like to tell you that you do not have to worry as these health checkups are confidential. That is, whatever we speak, whatever we check is between you and me, and it will not be given to your employer.
But how do I believe this? Because it is my organization arranged. It's not privately I had come to you on my own. It is arranged by my organization. The main reason why do they arrange it? In order to check whether we are all in sound health and good condition. Because they just want to filter some of the unhealthy workers who are in the factory working for a longer time and they want to make a replacement. So how do you say that you could not disclose it? Definitely you have to disclose what is the real health condition of the patient to the boss, right?
No, Mr. John, you're taking it wrong. Actually, these health checkups are done to provide a healthier environment and to ensure that all the health workers are fine, and it also makes them feel that the organization cares for them, so that if at all we do find something, this might help you reducing your workplace injuries, or it can also help in there are actually a wide range of benefits.
I do understand it's going to benefit us, but there are some kind of non-benefits and some kind of consequences we need to face in case if we suffer from some chronic disease. Why I'm so much bothered, doctor? Let me disclose the reality. The same way last year, a kind of health checkup had been conducted in my brother's organization. He too is a factory worker. But they came to know that he is suffering from diabetes, and they stopped him to continue his job. They had given him some kind of settlement and he lost his job. Now he is really without a job. He is just 5 years older than I. So that's my concern. These kind of organizations, they conduct it, but they are not bothered. They give some kind of settlement, but we are losing some 10-15 years of our service and other benefits. So that's my concern.
Firstly, I'm so sorry about what had happened with your brother. And coming to you, I totally understand your concern. So for that, I think it's always good to investigate. So if you do not mind, I request you to attend a local doctor and try to take a test for diabetes so that it can help you prevent diseases. And if that is the case, then go, we might think of considering you not going for the health checkup.
But here the organization is, the role of them and the reason for why they conduct this. This is the reality what I already told. Because we workers as of now we don't have any kind of complicated health issues. None of us are suffering from chronic disease as of now. Of course, no one had tested it for 10, 5 years. Even I have not tested whether I'm suffering from any of the chronic disease or diabetes or anything. But we are all sound in health and we are working regularly without any kind of medical leave. We are just working. But suddenly, why the organization arranged for it is something fishy. So I think it is to filter the non-performing people based on health.
It's good to know that all of you are in sound health. Uh, the reason these organizations help conduct health checkups is that it helps in individuals learn more about their own health. So in case you do have an issue which is not known to you, that might be known to you, and it will help you avoid future risks and issues for related to your health.
But doctor, as you say that without my permission, my health issues will not be disclosed to the organization. You are saying how could it be possible? Because with the assessment that you do, definitely the organization will check what happened to each and every person. So would you give a fake information, or how is it possible for you not to disclose it? I don't understand. Could you please explain on it?
Of course, these are confidential. That is, it is between you and me. So it will not be told to anybody else without your permission. Only if you allow us, we can share your information. This is how it is. The employer will obviously know what issues they have, but we can obviously, if at all you ask us not to share, we will stop that.
Yeah, that itself, some kind of clue that you are giving to them, right? That the person is not willing to disclose the health issue, so we are not. So that itself will lead to the conclusion that that I'm having some kind of problem in case if I have some problem.
In that case, we can just inform the team to, if at all they are, what we can do is we can ask them which employer's information they want, and that can be given to them.
No, doctor, I think it is a 15 minutes health assessment for each and every worker. They want to know about our health condition. Do we suffer from any kind of chronic disease? Is there productivity from our side? Would it hamper because of our health? So that's the reason they are conducting it, because the same way it has been conducted in my brother's factory too. So I know it better than the way you are thinking. But if you promise that the confidentiality would be kept between us, without my knowledge, you would not disclose it. Yeah, sure, I am agreeing for this assessment.
I understand your concern. From what I have known is that these health checkups are to provide a healthier workplaces for everyone. And yes, I assure you that it will be confidential and it will not be given to anyone.
Thank you, doctor. That's the promise I need. Yes, you could go ahead. May I know what is the 15 minutes assessment is?
So in this 15, of course, thank you so much for believing in me. In this 15 minutes, we will be checking your vitals, that is your blood pressure, sugars, temperature, and a few basic blood investigations, wherein we will try to know if you have any infection, and we will see if you're overweight, if you have any obesity issues.
Well, that sounds good. You could go ahead, and you have to keep up your promise. Thank you.
Of course, I'll keep up my promise. Thank you so much.
Right. So you have spoken well, but what is that, the 15 minutes assessment, this you have to hit on the head in the beginning itself. So when you were
Okay.
introducing yourself, we are going to do a kind of 15 minutes health assessment to each and every factory worker. And it is a general assessment, like these all the things we are going to do. So if you would have spoken in the beginning itself, off of the conversation, you would have, avoided, rather, just keep on the patient, I mean, the person is again asking, having confusion.
Okay.
And apart from that, yeah, because, they don't know what is the 15 minutes assessment. Okay, so as a doctor, as you have visited a factory, and factory workers may be literate or illiterate or normal lay person, common man, they might not know what is this 15 minutes assessment. So as a doctor, you have to introduce yourself, saying that I'm Dr. Sora from the, community health center, and your boss, your organization arranged for 15 minutes assessment for each and every factory workers. And this assessment is going to be these things. It is definitely going to help each and every person to know what is your health condition, and if there is any kind of disturbance in your health, or any kind of illness or chronic disease that you have, this is the right time for you to claim, the medical claim also. You can claim from the organization, and you can treat yourself. So these all the places. See, when again when I was as a person, I was asking you that definitely it would hamper my service, and I might lose my job, and they might check me out, terminate me, all these things. The legal point also, as a doctor, you could bring in to see, as a factory worker, as we are all working for so many years, more than 5 years, permanent workers means we are workers in that particular organization. So in case if we suffer from any kind of chronic disease, it is a responsibility of the organization to treat. So medical claim we can go for, right? As per the law, it is there. So these are all the valuable points that you have to pop in. So you have to say that don't bother, definitely it is going to help you, and you will come to know what is your body weight, what is the BMI, and what is your health condition. Are you hale and healthy, or you are sensitive or prone to any kind of disease? Is it in the starting stage or advanced stage? By doing the by doing the blood test, we will come to know. And moreover, if you want, you can relate to the current COVID also, you could speak about. Okay, so you could say that, as you people know that we are facing this COVID-19 corona situation, so health checkup is mandatory for each and every one. And if you people have any kind of disease, you could treat it, and then you could get all right, get back into your job. If it is something serious, definitely you can get all kind of benefits and mediclaim from the organization. So it is going to help you, the factory workers, rather than the organization. And your brother's case, it is something different, which which has went wrong. That I really don't know. But in this particular organization, I come to know that it is all going to benefit you. I can agree, I can understand what is the fear and doubt that you have. But this is the thing. So clarity, if you give, automatically the patient would have cooperated in the second or third speeches, third dialogue itself. Okay.
Okay.
Rather coming to the last. Finally, you have to convince, but how you have to convince, it matters.